Have you ever experienced anxiety? Ever had your heart race, palms sweat, or felt a sense of impending doom? Well, these are some of the common indicators of anxiety, a natural response to perceived danger, stress, or uncertainty. It's that uneasy feeling that something isn't quite right. It's a bit like an alarm system that goes off in your brain, prompting physiological responses such as an increased heart rate, rapid breathing, and sweating. Now, don't confuse this with everyday nervousness or fear. Anxiety is more than just feeling stressed or worried. It's a persistent feeling that sticks around, even when the stressor is gone. It's like a shadow that follows you around, even on sunny days. Anxiety, in essence, is a normal part of life and can even be beneficial at times, pushing us to act when we might not otherwise. But when these feelings of intense fear and distress become overwhelming and prevent us from doing everyday activities, it might be an indication of an anxiety disorder. Anxiety disorders are more than just occasional fear or worry. They represent a group of conditions where fear or anxiety becomes so severe that it can interfere with a person's daily life. There's a laundry list of anxiety disorders, each with unique characteristics. Generalized anxiety disorder, panic disorder, and social anxiety disorder are some of the more common ones. Each type affects individuals differently, painting a complex picture of how anxiety can manifest. The prevalence of these disorders is also quite high. Countless people across the globe grapple with some form of anxiety disorder, making it a pressing issue in mental health. Among these, there's one that stands out due to its specific nature. It's called specific phobia. This term may sound familiar as it's often thrown around in conversations. However, it's more than just an intense fear of something. One such anxiety disorder that we often hear about is specific phobia. But what does that really mean? A specific phobia is an excessive and irrational fear of a specific object, situation, or activity. This isn't your run-of-the-mill fear. We're talking about a dread that's so intense it disrupts daily life. Think of a fear of spiders that's so crippling you can't enter a room without checking every corner first. Or a fear of heights that keeps you from climbing a single flight of stairs. This is how specific phobia stands distinct from other anxiety disorders. Now you might be wondering what causes this specific phobia. The exact cause of specific phobias is unknown, but they often run in families and can be influenced by life events. Genetics may play a role. If a close family member has a phobia, you might be more likely to have one too. Environmental factors, such as a traumatic event, can also trigger a phobia. For example, a person might develop a fear of dogs after being bitten by one. So while we can't pinpoint one definitive cause, various factors can contribute. So, how can we tell if someone might be dealing with a specific phobia? Diagnosing a specific phobia involves recognizing certain telltale symptoms. These symptoms can manifest both physically and psychologically. Let's delve into this. On the physical front, individuals may experience an accelerated heart rate, excessive sweating, trembling, and even difficulty in breathing when confronted with the subject of their fear. It's akin to the body sounding an alarm, preparing for a perceived threat. Psychologically, the symptoms are no less profound. There's an intense, irrational fear or anxiety tied to a particular object or situation. This fear often leads individuals to go to great lengths to avoid the source of their anxiety, which can severely hamper their daily life. A person with arachnophobia, for example, may refuse to visit a friend who owns a pet spider, despite knowing that the spider poses no real danger. So how is a specific phobia diagnosed? It begins with a clinical interview, where a mental health professional discusses the person's symptoms, fears, and the impact on their life. The professional uses certain criteria to determine if the fear is irrational, persistent, and causes significant distress or impairment. This includes ruling out other potential mental health disorders. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, often referred to as the DSM-5, provides a comprehensive guide for such diagnoses. It's a tool that helps to ensure consistency and accuracy in the diagnosis of specific phobias. Once a specific phobia is diagnosed, how can it be treated? Fortunately, specific phobias are among the most treatable of anxiety disorders. The journey towards overcoming a specific phobia often involves professional help, and there are a variety of effective treatment methods to choose from. One of the most common methods is cognitive behavioral therapy, or CBT. This approach focuses on changing the thought patterns that lead to fear and anxiety. Through CBT, individuals learn to challenge their fears, understand them better, and ultimately gain control over them. Another widely used treatment is exposure therapy. In this method, the person is gradually and repeatedly exposed to the source of their fear in a safe and controlled environment. Over time, this exposure can help reduce the fear response and increase the individual's ability to manage their anxiety. For some, medication may be a helpful part of treatment. While not a cure, certain medications can help manage symptoms of anxiety and make other forms of therapy more effective. It's important to understand that medication should be considered as part of a comprehensive treatment plan and not as a standalone solution. Regardless of the method chosen, the critical first step is seeking help. Professional guidance can provide the tools and strategies necessary to tackle a specific phobia head-on. Remember, it's never too late to seek help and take control of your life. Anxiety disorders like specific phobia are manageable and you don't have to face them alone.